Go, Ned! Quite often be good for you.
I just read about it in the paper today.
No evidence of disease. They're 4 words every cancer patient wants to hear, but also the name of a very unique rock band. My name is Stephanie Steinberg, and I'm an assistant health editor at U.S. News and World Report. Today I'm joined by 4 members of No Evidence of Disease. They're gynecologic surgeons who are on a mission to raise awareness about GYN cancers through their music. Thanks for joining me today.
You're welcome.
Hello.
Hey there.
Hi. Do you guys mind introducing yourselves and saying where you work and what you play?
Nemish, take it away.
Yeah, my name is Nemish, Dr. Nagrasheth. I am at Mount Sinai Medical Center in New York and also Englewood Hospital in Englewood, New Jersey. I serve as Associate Director of Gynecologic Oncology at Mount Sinai and Director of Gynecologic Oncology at Englewood Hospital, and I play drums and percussion for No Evidence of Disease.
I'm Will Winter. I'm out in Portland, Oregon. I work with Compass Oncology, and I play the lead guitar in the band.
And my name is William Robinson, but I go by Rusty, and I'm a professor at Tulane in New Orleans, Tulane Cancer Center and Tulane Medical School, and I play bass guitar.
All right. Well, can you guys sort of explain why you decided to form this band?
It's complicated.
Nemish told us so.
It wasn't really a formal decision to start the band. We had a lot of people interested in helping this band and making it work. So it started off in 2008, and one of our good friends, Larry Maxwell, kind of recruited Will and I to start a group, really just for a one-time show. We were to play at a doctor's convention that. Yeah, a cover band, essentially, just for entertainment between educational sessions, essentially. But what happened at that show is we played, and we had several, probably 1,500 people at that event, and suddenly after we played, people said, you know, that's a really good band, it's a really good idea, why don't you take this to the next level? And through a lot of encouragement, we became No Evidence of Disease. But it really started off as a one-time show playing for our colleagues. It's turned into something quite different.
And I know you guys are all over the country, so how do you make this work?
Well, you wouldn't know it by how much trouble we had getting on the call today, but we actually do a lot through video conferencing, FaceTime, Google Plus now. We do a lot of stuff, via email. But the bottom line is actually when we get most of our work, if you want to call it that, done, is usually the day or two before the gig is when we have our biggest sort of most intense rehearsals, learn new music. We try and write it beforehand and then just kind of come in and, it's a testament to how good the other folks are in the band that they can pick it up very quickly. And so we do a lot of stuff over the internet just by necessity.
Now, September is Gynecologic Cancer Awareness Month. For those who don't know, can you sort of explain what GYN cancers are?
Well, GYN cancers, in general, I think a lot of people, the first assumption is that we take care of patients with breast cancer, which is actually the one we don't typically take care of. And I say typically because there are some that do. But basically, it's ovarian cancer, uterine cancer, cervical cancer. Those are big 3. And then you have vulvar cancer, gestational trophoblastic disease, which is essentially a cancer of pregnancy tissue, of the placental type tissue, amongst other things, vaginal cancer. Again, breast cancer gets a lot of publicity, and it wasn't long ago that wasn't the case. And so we're sort of the redheaded stepchild, no pun intended, of women's cancers. And what we want to do is, and the whole idea behind this band is to, make women and everyone, not just women, but women and men, aware of what gynecologic cancer is, and that's not just breast cancer.
And I know that it's estimated that about 91,000 new cases will occur this year, and there's expected to be about 28,000 deaths. So why do you think that not as many people know about these diseases when these numbers are so large?
Part of it is the stigma. There's always been some reluctance for women to talk about the genital tract. All of us obviously to talk about the genital tract. And that's been a big part of it. People just don't want to talk about those issues, particularly in older women. It's difficult sometimes to get past that, to get patients to open up about what's going on with them. So they don't like to talk about it. I think that's a major part of it. A second part of it is that one of the big cancers we deal with is cancer of the cervix, and it has traditionally been something of a disease of lower socioeconomic status women. And, they don't have the political or vocal clout that some other people do, so therefore I think they get sort of short shrift. So you put those things together, and there's simply not as much, people are not as many people willing to talk with the disease. I think the other thing, too, is that so many of our patients are sick for so much of the course of their disease. In other words, they just don't feel good, so they're not really up to being advocates for themselves the way some other diseases are. So I think all of those things kind of are responsible.
Is there anything that women can do to prevent some of these diseases?
Pap smears for cervix cancer, for sure.
Yeah. Birth control.
Eventually, the HPV vaccine.
Right.
If we use the HPV vaccine on a widespread basis in the United States, that disease would be all but eliminated in a generation.
Yeah, Pap smear plus HPV is really going to eradicate cervical cancer. It mostly has.
Yeah,
and then for ovarian cancer, the birth control pill can help prevent, but that's not for everyone. You really need to speak with your physician and make sure you don't have contraindications to have it. But taking the birth control pill for just 2 years of your lifetime can reduce your risk of ovarian cancer by up to 50%. So there's some common things that we do every day that really can be very beneficial.
All right.
Ultimately, I think just having a good relationship with your physician and being able to reach out if you have any symptoms, feeling comfortable reporting any concerns that you have, being in touch with your own body is really the best way to prevent and early detect cancers.
Right, and it's also knowing the symptoms too. Vaginal bleeding after you've stopped having periods is a big thing for endometrial cancer, for instance. Problem with other cancers like ovarian cancer is it's bloating, nausea, vomiting, abdominal pain, which can be very vague symptomatology, and can be, ovarian cancer could be you had a bad taco. That's really hard to screen for. But knowing the symptoms is key, especially for the vaginal bleeding. It's very important.
And I know a lot of the patients that you treat at least have found some solace in your music. So, what is it that you hope to accomplish through your band and your music?
I think it's long been known that music is one of the great communicators in general. So we can communicate quite a bit through music. And while we work with patients on a daily basis, and it's very rewarding, and it's a privilege, obviously, to take care of these patients. Ultimately, you're taking care of one patient at a time, whereas music can help get the word out to thousands of people at one time, and it really has. It's gotten people together. It's gotten us more unified as physicians, and also more unified with the patients as well. And so I think that's one of the things. But the healing powers of music is also something that I'm personally very interested in. And I really believe that there is some healing power to music, and it has to do with first just healing the mind, and then the mind kind of healing the body. And we see that in other alternative forms of medicine as well. And there's probably something for that, I would say, even for us as members of the band. I mean, you guys can correct me if I'm wrong. And then patients are telling us that too. Most of our songs don't relate directly to care of patients. There's a couple that do. But the couple that do, I've had patients really tell me that those particular songs they could relate to and kind of understand the disease process a little bit better just by hearing that song. So.
Yeah, the interesting thing about our music, and like Nimish said, we don't focus, we don't write a song to say, like, okay, we want to talk about this aspect of cancer care. We want to talk about life in general, because I'll add on to what Nimish said, our patients are very into it but our patients already, unfortunately, are aware of gynecologic cancers because they've already gotten to us. The awareness that I would like to see happen is awareness on a wider scale on the people we don't see in our clinics. So, you know, the whole idea behind the music is to make it generalizable to any life situation so that someone can be walking down the street, or not walking down the street, whatever, listen to our music, have no idea about gynecologic cancers, and, you know, get into this music, find out about the band, and, you know, by hook and by crook, they're there, and we've got them, you know, we've got them captured, and they're going to learn, you know, and they learn about GYN cancers. And so it's catching the people who are unaware and sort of, you know, out in public, just they don't know.
All right. Well, I know Nimish has to run into surgery, so I'll wrap this up. But thank you guys for joining me today. If you're interested in finding out more about No Evidence of Disease, they're going to be featured in a documentary that will be playing in select theaters in September. So thank you all for joining me today.
Thank you,
Stephanie.
Stephanie. Thank you.